For parents, having a sick child can be an unsettling time, and all you want to do is to ease their suffering and make them better as quickly as possible. However, a new survey has revealed that knowing what medicine to give your child in these situations can be very confusing for mums. Ibuprofen and paracetamol-based medicines are the two main types of pain-relieving treatments suitable for young children. Well, I'm here today to talk with Claire to discuss what individual benefits these treatments have and to discuss her concerns and worries about giving her young daughter Dixie pain relief. Well, Claire, Dixie is 3 years old now. Am I right in thinking she's had her fair share of illnesses in that time?
Yes, definitely. Teething was a particularly difficult time. She had a high temperature, she wasn't sleeping very well at night, so that was quite hard on us as a family.
What kind of symptoms did she have and how did you treat them?
So other than the high temperature, a runny nose and sometimes sore ears, those were kind of the symptoms that she used to develop. Some other mum friends of mine, they suggested paracetamol, and also my mum used to use that on me when I was younger.
Well, paracetamol is certainly a very popular choice amongst mums, but we've also got available to us ibuprofen, which is a suitable treatment that treats pain and fever associated, for example, with earache and teething as well. Ibuprofen also, as it happens, has anti-inflammatory properties, so if there's any inflammation at the root of the cause of the pain or the fever, that's useful, especially for that.
So does ibuprofen work as fast as paracetamol?
Ibuprofen can work within 15 minutes to treat a fever.
Okay, I didn't realise that. I didn't realise it reduced fever. I thought it was just for general pain relief and kind of bumps and bruises. Does it work on a cold?
Choosing between paracetamol and ibuprofen would really depend on Dixie's symptoms. Both paracetamol and ibuprofen are effective in reducing pain and fever, but you wouldn't use either of them to treat a runny nose or sleeplessness or a cough, for example. But if you're treating a fever which is more than 38 degrees centigrade, then you could use either ibuprofen or paracetamol, but ibuprofen has been clinically proven to last for up to 8 hours. And I don't know if Dixie's ever had a temperature lasting all night.
Definitely, so that's really good to know that it lasts that long. I was always a bit concerned that it was a bit too harsh for younger children, is that true?
Again, that's a common misconception. In fact, ibuprofen is suitable for children and is deemed gentle enough to be given to babies of just 3 months of age and who weigh more than 5 kilos. Hopefully, the advice I've given Claire will also come in useful for you and your child. Here's a recap of the things that I think are worth remembering when giving your child medicine. You should always read the label of your child's medicine to check for the following things. If the medicine treats the symptoms of the illness your child is suffering from. Remember, a runny nose, cough or sleeplessness doesn't respond to ibuprofen or paracetamol. Fever can be treated by either ibuprofen or paracetamol medicine made for children. If your child needs all-night fever relief, an ibuprofen remedy has been clinically proven to last for up to 8 hours. Pain caused by teething, earache or colds and flu can be treated either by ibuprofen or paracetamol. If a child is suffering from aches and pains associated with inflammation, an ibuprofen remedy can offer effective relief as it also has anti-inflammatory properties. How much you should give. The recent research shows that many mums worry about whether they give their child the right dose. Always follow the directions, never guess, and always keep an eye on the amount of time you leave between doses. Some medicines come with a simple dosing device, such as a syringe, to help you give the correct amount. And finally, if you're in any doubt at all, or the symptoms last longer than 3 days, do go and see your doctor.